AIDIT is a structured patient interaction tool that we use in IU Health and other places. It's AIDET, and it is designed more for folks in, say, the receiving area for radiology. And it's a way of interacting with patients in a standardized way to try to hit all the points that each patient wants. There's a modified version of it that we use as physicians, and especially in our position, we've got to modify a few things, and that's what I'm going to show for you. But what are the components of this interaction with the patient? Well, it's acknowledge, which is very important. Make sure you've got the right patient. Make sure you're walking into the right room, talking to the right person about the right surgery. At least once a year, I walk into the wrong pre-op room and I say, "Hello, are you Mr. Smith?" And the patient says, "No." Good to stop the conversation right there. So acknowledge the patient. Introduce is I, and it's important not to just introduce yourself by name, but also make sure the patient understands what your role in their care is. Make sure that they know that you are the resident from the Department of Anesthesiology. It's a teaching hospital. Our patients are under a ton of stress. They're seen by maybe 10 people in the morning. It's hard for them to keep track of who is who. You're an important part of their care. You're somebody that they need to understand what your role is. So make sure that they understand what department you're from and that you're the resident. And then when I come in, it makes for a very easy conversation. I say, "I'm the attending. I'm Dr. Smith's boss." And they say, "Oh, yeah, okay, he told me you'd be in here." Just makes the morning run very smoothly if they understand your introduction well. So acknowledge, introduce. D is for describe, and that's the bulk of what you're doing. We are going to A, interview the patient, and B, describe what to expect as far as the anesthetic experience goes, and that also includes getting consent for the anesthetic procedures. So acknowledge, introduce, and describe. E is for estimate. That's not as important for us as it is for other places in the hospital, but patients are very interested in an estimate of how long am I going to be waiting. This is a tertiary care hospital. We do cancer surgeries. We get behind just a little bit. If patients ask you or families ask you, "Hey, we're on schedule for 2 o'clock. When are we actually going back?" Just remember, always under-promise and over-deliver. So don't promise we're going to be in the room in 30 minutes when there is no way we're going to be in the room in 30 minutes. People get really angry. They're under a ton of stress. So if you have to give estimates, always estimate on the conservative side. So acknowledge, introduce, describe, estimate, and then T is for thank you. Thank you is a little weird for us interviewing the patient and then immediately proceeding with caring for the patient. So we replace that with just some sort of expression of, "Hey, looking forward to taking care of you. We're going to really..." AIDIT is more useful than it sounded when you first got trained on it, but just kind of modify it to suit our needs in the pre-op interview. And again, interview your dog over and over this weekend. You got several days to get ready so that you're slick the first time you try it. You're not going to be slick the first time you try it. So here's my interview. We're going to imagine that Barry is here for a lap chole. He's got an otherwise benign medical history. These are the things I tell every single patient. Knock, knock. I did hand hygiene, by the way. Hands are clean.
Yep.
Good morning.
Good morning.
Hey, are you Mr. Neary?
I am.
Nice to meet you. My name is Dr. Wolf. I'm going to be the faculty anesthesiologist taking care of you today.
Okay.
Who have you brought with you today?
This is my granddaughter.
Oh, very nice to meet you. We're going to take great care of your granddad today. The schedule says that you have a gallbladder that needs to come out, and Dr. Nakeeb's going to do that for you today. Is that correct?
Yes.
All right. My job is to make this seem like the best idea you've ever had.
Okay.
I've got a few questions. I've read through your medical chart, but I do have a few questions just to make sure I'm not missing anything in your medical history. I always start my interview with a trick question, though. Hey, what'd you have for breakfast?
Nothing. You told me I couldn't eat.
Perfect.
Okay.
Have you had any medicines today?
I have.
Which medicines did you take this morning?
Flexeril.
Okay. Is it working?
Yeah.
Okay. Speaking of medications, any allergies, any medications treat you badly?
No.
And how about with anesthesia? Sedation or anesthesia, any problems, side effects?
A little nauseous.
Okay, very common, unfortunately.
Okay.
Okay. Health-wise, reading through your chart, I see you've got some low back pain, that's what the Flexeril's for, and really no other medical problems to talk about.
That's it.
You are my kind of patient. Just to make sure, I'm going to run through my laundry list of problems you don't have. No strokes, seizures, or other neurologic problems.
Nope.
Nothing wrong with your heart. High blood pressure, abnormal rhythms, heart attacks, nothing like that.
Nope.
No lung problems, asthma, emphysema, not a smoker.
Uh-oh.
No liver problems that you know about. Hepatitis or cirrhosis.
Nope.
Kidney function's good as far as you know. How about heartburn or reflux? Big issue, not too bad.
Not too bad.
Any dental issues, loose cracked teeth?
Nope.
Anything
All
that
mine.
comes out? Partials, plates, or dentures?
All mine.
Gotta ask everybody. How about sleep apnea? Do you use a CPAP
I do.
machine? Oh, good. Do you have your machine with you?
I do.
Any idea what your settings are on that?
I have no
That's okay. We're going to bring that with us to the operating room, and that way in recovery room, if you need it, we've already got it. So that's great that you brought it with you.
Okay.
Anything else I need to know about you as far as healthcare goes?
I'm scared.
All right, I'm going to take care of that.
Okay.
We have an app for that.
Okay.
And at this point, I would do my physical exam. So that's going to be airway exam, heart and lungs in most patients. And we'll kind of talk about that when we go through the documentation. As far as the anesthetic plan, what to expect for today, we're going to do what we call general anesthesia. So that means you sleep through surgery. So sequence of events, what to expect. We're going to get back into the OR, and I expect us to be in there in about 45 minutes. They're cleaning the room up for us right now. First thing we'll do is help you to the operating room bed, and then we will descend on you like a NASCAR pit crew for a second. So monitors go on, we'll put some squeezers on your legs, warm blankets go on. I'll give you oxygen through the face mask. And basically, as soon as your first blood pressure pops up on my monitor, I'm going to start dosing medicine through that IV there in your hand. And from your perspective, the room is going to spin around. This is just going to seem like a great idea, and then you'll be done, waking up in recovery room. While you're asleep, there are a few things I'm going to do. And the main thing is I'm going to put a breathing tube into your mouth, and that's how I give you the gas that keeps you asleep. Why do I mention that? Well, you may have a sore throat for about a day after surgery, very common from the breathing tube. We're also going to put another IV in while you're sleeping, so you go to sleep with that one in your hand, you'll wake up with one on the other side. So you go to sleep with one and wake up with two. Hey, we did that while you were sleeping. And at that point, I'll turn you over to Dr. Nakib and we'll get this operation done. Before you wake up, we're going to load you up with some pain medicine through your IV. We're also going to give you not one, but two kinds of nausea medicine. Since you've been nauseated in the past, we're going to be a little more aggressive with that and try to wake you up with decent pain control and with as little nausea as possible. And you'll just find yourself in a recovery room talking to a nurse. Just tell her how you feel. So if you need something for pain, we got it. Nausea, we got it. Itchy, anxious, cold, whatever's bothering you, we're going to make you feel better. And a guy like yourself, pretty healthy, having minor surgery, I expect you to be clear-headed and feeling okay within about an hour. And at that point, you'll go up to room and you'll see your family again.
Great.
So that is my plan for the day. As far as risks of anesthesia, things I should tell you about, the more common things are the sore throat and the nausea that I mentioned. Serious stuff for a guy like yourself who's pretty healthy are very, very rare. But things we always think about would include allergies, heart problems, lung problems. Chipping a tooth while we put the breathing tube in would be the main things. Overall, I expect this to be a nice, quick, boring surgery, which is just how we like it.
Okay.
Questions, concerns, anything else I can tell you?
Well, I'm ready.
All right, let me grab my consent form and I'll get your signature. And here is our consent for anesthesia services. I'll walk you through this. What are we planning on doing? I checked the box for general anesthesia right there. Who is going to be doing it? Myself and other members of the anesthesia department. Is there anything specific we said we would not do today? I put none there. Now, this section down here is the long, scary version of what we just talked about. You can read or not read that at your discretion.
Okay.
And what I'll need from you eventually is a signature, printed name, date, and time.
Okay.
All right. Well, I am going to go get my stuff ready for you in the operating room. I'll see you back there in a few minutes as soon as the nurses are ready. Any final questions? Anything else I can tell you?
Nope, sounds good.
Okay. Looking forward to taking care of you. I'll meet you in the OR.
Thank you. Did you hear the music? I'm ready to go. It was great.
Barry, I'm just going to say, culture of hand washing. I feel very wrong walking away from you without washing my hands right now. It just feels wrong.